Well, there is some promising news this morning about Alzheimer's disease, which now affects more than 5 million Americans and their families. The FDA actually has approved a new brain scan that may help diagnose the disease.
And that's one of several new developments ahead of a big Alzheimer's conference this weekend. Dr. Jon LaPook is with us to help us understand a little bit better what's actually happening here. So talk to us first about this brain scan and what it can do.
So this brain scan, you give a radioactive dye, and it lights up these areas where there's amyloid. Amyloid lights up in red. And amyloid is that gooey substance that can kind of muck up the brain cells, the communication between the brain cells.
Those plaques?
Those plaques, right. And it causes, the theory is that amyloid causes Alzheimer's, but that's not proven.
So if you have this test, though, and it does show up, then what happens?
Well, until this test, you had to diagnose amyloid at autopsy, right? If you don't have amyloid, you don't have Alzheimer's. So now you can do it during life, and the big question is, okay, what does it mean if you have it? So there's a big test co-led by Dr. Doraiswamy at Duke out in neurology that said, we're going to follow people who are either normal or they have some problems with memory. We're going to give them the scans. We're going to follow them over 18 months, 36 months, see what happens. Well, it turns out if they lit up with amyloid, they had a higher chance of going on to Alzheimer's. But what was really interesting, or as interesting, is that people who came in with a diagnosis of Alzheimer's, a third of them had negative scans, so it was the wrong diagnosis.
So it's not definitive.
Well,
but it gives you a better indication. So then why, if there is that chance, why would you want to have it done?
Why would you want to have the right? For one thing, we followed a man who was the very first person in New York State to get this Amivid test, okay? And he came in, he thought, 80 years old, he thought he had Alzheimer's. He had all those signs and symptoms, okay? Well, he was starting to wind down his life. And he had the test, and it turned out it was negative. Dr. Sam Gandy ran it out of Mount Sinai. And so he's really changing his plans. It turns out he has something else. There are lots of other things that can cause dementia other than Alzheimer's. About a third is because of tiny little strokes in the head. You can have low thyroid, you can have low B12. So if it's a negative scan, then let's look for other things and change your life plans. If it's a positive scan, we're really not sure yet exactly what it means, because 20 to 30% of seemingly normal people over the age of 65 do light up positive for the scan. Now, right now, it's been very disappointing in terms of the trials of medications to treat Alzheimer's, as we all know. Devastating disease.
Wait a minute, what does that do to that? Because if there is this sort of predictor, or at least a sense of what we're doing, does that give us at least a leg up on it?
To me, it totally changes the way we're going to approach it. Because right now, a lot of the medicines, these are these antibodies that sop up the amyloid, and they've been given to people who already have Alzheimer's disease, and they've been very disappointing, okay? Now, the attention's saying, let's go. It turns out this other studies show maybe 10, 20, even more years before you actually get the disease, you start to get the amyloid plaque. So the obvious question is, why don't we give some of these medicines, rather than waiting till the end, give it preventatively? And think about heart disease, right? If you wait till somebody's had 5 heart attacks and then give the Lipitor, they're already in heart failure, it's too late. Let's try to prevent it, give it earlier.
Fascinating stuff. Nice to see you, Jon. Thanks.